Hi, my name is Shital and I am the CEO of Progressive Care. And I wanted to take a few minutes today to talk about why now is such a critical time for our healthcare system, talk a little bit about masks, therapies and treatment, and what we can all expect once we start seeing social distancing guidelines ease a little bit. So I'm going to jump right into why this is such a critical time right now, and we're kind of wondering why this is happening, given that we've kind of heard about social distancing for 3 weeks already, and we're still seeing acceleration. Why is that happening? And the reason that is because COVID-19, the coronavirus, has a long incubation period in the body. So we will feel fine for a period of time while we're infected, and during that time we can infect others. So there is this lag period between the time when we get exposed to the time when we start feeling critically ill and start entering the hospital system. So now is a really critical time for our healthcare system to accumulate supplies, to implement an aggressive testing strategy, and to prepare our ICU bed and inpatient bed capacity for patients who are going to be arriving in the next 14 to 21 days. There's still a lot of states who have resisted the calls to implement social distancing protocols in their strictest sense, and I strongly encourage them. Now is the time. Nobody is immune. No state will be prevented from having an influx of confirmed cases of the virus in their community. So now is the time to really stay home. Now is the time to prevent ourselves from going out into the general public as much as we can, limiting ourselves to being at home, getting deliveries, doing teleconferencing as much as we can. And I know that we're starting to feel that social distancing fatigue. For a lot of us, we've been doing this for a few weeks now, and we've been hearing this for a few weeks now. Schools have been closed for a couple of weeks already. And so we're getting a little bit antsy to get out into the public and start seeing our friends and family again and start going about our normal lives. And that now is really not the time to lose patience. The next 30 days is very, very important. We need to prevent ourselves from feeling that urge to get out there and come in close contact with others, to allow that time. We're going to start hearing some really bad news coming out of places like New York, even here in Florida, where we just recently implemented a statewide shutdown. We're going to start hearing that really negative news. You're going to hear a lot about deaths and increasing confirmed cases, and it's going to feel really scary, but now is not the time to lose hope or to lose our patience. We need to stay home. We need to stay safe. We need to stay virus-free. And this time period is really important, because if we can adhere to strict social distancing guidelines, then that April 30th date starts seeming very realistic, where we can start easing a little bit and start entering the workforce more and going out more, still maintaining social distance, but still easing our restrictions a little bit. So now is very important that we take all of the guidelines very seriously and do the best we can to prevent as many people entering the hospital system as possible. And one thing I want to remind everybody is that COVID-19 is not the only thing that doctors are treating right now. We typically have on any given day people who have heart attacks or strokes or cancers or traumas that take them to the ER on any given day. So, on top of that, to then have a number of patients enter the system that are COVID-19, we don't have surge capacity right now for those patients. So when those patients arrive in the hospital, now doctors are going to have to pick and choose who they can care for and who they cannot. And we want to make those decisions as small as possible so that everybody can get the care that they need. So now you need to really monitor your own health and well-being, take your medications as prescribed, communicate with your doctors. Now's not the time to be rationing pills or rationing medication. You need to stay well to prevent yourself from going to the hospital for something that could have been prevented by just taking care of yourself. The next thing I want to talk about is the masks, because there's a lot of confusion, and we had already said don't wear masks if you're well, save those for the healthcare workers, and most of that is true. So yes, N95 and surgical masks should be reserved for healthcare workers. We don't want to take that supply that is critical supply, and there's already shortage. And understand that for a healthcare worker, they're not just going to be treating COVID-19 patients with just a mask by itself. They're going to be wearing other PPE, which is personal protective gear here, personal protective equipment. They're going to be wearing eye shields. They're going to be wearing face shields and coverings. So that's really important for them that they have all of that PPE available to them. For us, now we're hearing that it is important that the general public, when they walk out their front doors, to be wearing some kind of face covering. They're not talking about medical grade masks here. They're talking about maybe a cloth mask, a scarf, bandana, some kind of covering. And the purpose of that covering is to prevent respiratory droplets from entering the air supply and possibly infecting somebody else who may happen to be close to you. The reason for that is we can feel well and still spread the virus. About 25% of the people who are exposed to the coronavirus or are infected with COVID-19 will experience 0 symptoms. That means they won't get sick at all, but that doesn't mean that they can't spread it. So the respiratory droplets, we're not talking about extraneous spittle. Every day when we talk, we're expelling those droplets. Every day when we breathe, those droplets are just coming out. So it's part of its natural body process. And if there are coronavirus particles in those droplets for you because you have been exposed or infected and don't know it, that can spread to somebody else. So if we cover our mouths when we enter the public spaces, when we absolutely have to enter public spaces, we want to cover our mouths to prevent, so that that covering can catch those respiratory droplets, and it will prevent the likelihood of spreading the virus further. So again, just make sure you're not using those N95s or surgicals. Get a cloth mask. There are a lot of places where you can make your own. You can use any kind of cloth covering when you go out into the world, and that will prevent those respiratory droplets from possibly infecting somebody else. And then that leads me to the next thing, which is therapies and treatments and medication. We are all very, very hopeful that a vaccine will be forthcoming quickly, that testing will be very rapid and everybody will be able to get testing, and that there are existing medications that will treat the virus. The only caveat to that is now is not an opportunity to use these medications prophylactically and without the guidance of a physician who understands your body condition. And the reason I bring this up, and I'm going to talk about hydroxychloroquine, is that it has a known side effect of affecting heart tissue. So if you have a pre-existing heart condition, it can cause an arrhythmia, and that arrhythmia can lead to a fatal heart event. So we want to make sure that we are under the care of a physician, and that physician is prescribing it for emergency use or for clinical trials to assess the safety of that medication and make sure it works. So don't go running out to try to get this medication just to prevent yourself from getting the virus, and don't go running out if you're experiencing mild or moderate symptoms. Those medications actually are used to treat malaria and lupus and rheumatoid arthritis, and those patients still need it. Those patients still are requiring to take those medications on a daily basis. So we want to make sure that there's enough supply for those that are already on it. But I am hopeful that the CDC and the FDA will evaluate the effectiveness, and that's going to come around to the rest of us and start speeding up the process here, where we can start realizing those benefits of having a known treatment for COVID-19. So the last thing I want to talk about is what the world's going to look like when all this is starting to pass. And the number one thing that I wanted to stress to everybody is that on April 30th, when we hope we can start easing restrictions, we're not going to be able to go run out and hug each other. We're not going to be able to go to our sporting events right away. A lot of those things are still going to be canceled. A lot of those things we're still going to be restricted from doing. So it's going to be a slow return back to normal. And so now's not the time to lose our patience. Now's the time to really focus on our mental health, focus on our emotional and physical well-being, so that we can find a pathway forward for a new normal for us. It's going to be a long haul before we're able to do things the way we did last year, be able to go to sporting events and go to movies and do all those things. So take heart, take care of each other, stay safe, and stay at home as much as you can. We are here for you. Follow us on social media. Follow me, Shital Mars, on social media. Follow my company, Farmco RX, and we will be here to answer any questions you have. Stay safe and virus free.